The reality is there's a lot of confusion about the data that's out there about TIF and about CTIF. And I want to explain why that is. When TIF first came out, they really didn't have the technique ironed out. There was sort of an evolution of the technique over time, where initially they were actually suturing stomach to stomach. Then they worked on stomach to esophagus, then stomach to 2 or 3 or 4 centimeters of esophagus. And that's what we call the TIF 2.0 technique, which is really the technique that has been used since about 2009 on. Then in 2011, we published a paper that demonstrated that we had to pay more attention to the esophageal hiatus. And so we have some very good randomized, prospective, even sham trials that incorporate TIF, but the understanding of how important the hiatus wasn't well understood when those publications came out or when those studies were created. So even though we have good outcomes with TIF, it wasn't until we really understood when do we repair the hiatus and what means do we use to measure the hiatus to tell us when to repair it. And that came later in the 2015-2016 era, to the point where the FDA allowed a change in the instructions for use and allowed us to instruct when do we repair the hiatus at the same time that we do a TIF. And that's referred to as C-TIF, or crural closure with TIF, or hybrid TIF, right? That's where we go in, repair the diaphragm so that the TIF valve or the TIF fundoplication remains below the diaphragm, which is a lesson we learned back in the days when we were doing Nissens, is if it's not below the diaphragm, it doesn't work, even if it's a Nissen. So the studies that we rely on now, the TEMPO trial and the RESPECT trial, show that TIF is superior to proton pump inhibitors, that TIF is durable as a fundoplication. It's stable from year 1 through year 3 through year 5 in the TEMPO trial. But then there was also a separate study that we did that showed if you do the HADA repair and your TIF is and the TIF fundoplication remains intact, that at 6 months, 95% of those patients have normalized their pH. So we actually have objective pH data that demonstrates that the valve and the HADA repair, when they're intact, are working at a very high level.